There's other issues as well, but I'll mention one more, the sustained growth rate, the Medicare updates for what we receive for seeing Medicare patients. We're in a heap of trouble because all the Medicare savings that were going to be used to fix that have been used to establish the new entitlement. Now, this is not Bill Cassidy, the Republican, say it. There was an AP story this past Sunday that spoke of the same thing, about how they used the potential savings from Medicare, not to short Medicare, but to create the new entitlement. CBO or CMS, I forget which, Congressional Budget Office or Center for Medicaid and Medicare Services, also said, if we get savings from Medicare, we should use it to short the program. They were critical of using it to create another entitlement. And that leads me to the last issue, which is not of us as physicians, but it's us as Americans. We have an existential threat right now before our country called the national deficit. It's incredible. Think about this. We just raised taxes $500 billion. It's estimated we'll raise taxes another $500 billion in the next year or so. We're going to put on, in addition to that, a 20% VAT tax. That's the projection. We don't get rid of the income tax, we just put a VAT on, a value-added tax, and our deficit is still going to grow. I was told that the amount of tax dollars we got this past year is only sufficient to pay for the entitlements, and everything else, whether it's NIH, the wars, highways, locks and dams, NOAA, you name it, is all borrowed. Now that is an existential threat to our existence, and by the way, that's the reason it's going to be so hard to fix the SGR. There is no money out there to fix it. Even if you raise taxes, there is still no money. So, we got problems. On the other hand, I like to say never bet against the American people. And that's why I want to congratulate you guys for being involved. Now, frankly, there's some of our colleagues that think it's beneath themselves to be involved in politics. They will complain to the doctors in the hospital cafeteria, but by golly, for them to support somebody, they just feel like they're a little dirty. And I try to put this in perspective once. Again, my mentors were Alan Redeker and Telfer Reynolds, among others. And those are the two men that motivated me to become a hepatologist. And I remember Dr. Reynolds, I don't know if any of you knew him, but they called him Black Pete, because when in his younger days he had black hair. Believed in the Socratic method. And on rounds he would sit and just grill you to make sure that you thought through the problem. And he was intimidated. So Black Pete was supposed to be your Western outlaw. And once Dr. Reynolds, who, just really after my father, was one of the most influential men of my life, he was on rounds. And we were at County Hospital, Rancho Los Amigos Hospital, and they had big open wards. Largest, before the transplant era, it was the largest liver unit in the United States. For a while, every hepatologist west of the Mississippi, except for one or two, had trained under Dr. Reynolds and Dr. Redeker. So we had this big ward of these encephalopathic patients. And so there was a fellow that had come in with encephalopathy, and he's confused. So, of course, we began hitting him with lactulose, 30 cc's Q hour. Pretty soon you hear some rumbling. And he wakes up a little bit. And in a very vulgar way, begins to exclaim at the top of his lungs that he needs to defecate. So we're on teaching rounds as he's telling us he has this defecatory urge. Dr. Reynolds stops teaching rounds, doesn't wait for an A, leans down, picks up the bedpan, picks up the guy's hips, slips it under his hips, and steps back and says, "Let her rip." Now I thought to myself, as I think of our colleagues that say, "Oh no, I can't be involved in politics. It is beneath me, it is dirty." I learned from my mentor that if it serves our patients, and I would add our country, there is nothing that should be beneath us. Even if it includes putting a bedpan beneath an encephalopathic patient. So similarly, in our system of government, there is no other way for us to affect public policy without being involved. How can you be involved? Well, Carol Kaczewski, who may be here, he's a gastroenterologist who's up in Boone, North Carolina. He was one of my fellows when I still am on faculty with LSU Med School. I'm still seeing patients. I'm in hepatitis clinic every Tuesday morning at our public hospital. And so Carol was one of my first fellows. And so we've stayed close through the years. He says, "Well, how can I be involved?" And I just started talking to him, because I see my role. You know how Janus is the God that looks this way and looks that way simultaneously? I look into healthcare, and I look into politics simultaneously, okay? So I will sometimes serve as a translator between the two worlds. So let me translate, as I said to Carol. Carol, if you want to be involved, first go meet your senators and go meet your congressman. It turns out for him it's a congressman, not a congresswoman. And I said, and then set up a function where your partners or the people in your ambulatory surgical center have a chance to meet him. And so and then show him around and introduce him to the nurses. And by the way, don't accept as an excuse that your partner's not going to be there because he says he's got to be or she's got to be someplace different. You make sure they are there because they need to understand that his understanding of an ASC is incredibly important to that ASC. And then when you bring them in, if you've built a relationship and you feel comfortable, at some point, work in his campaign. Host a fundraiser. Have a coffee during the campaign. Because there's an old governor of Louisiana, Earl Long. He said, if you're with me in the primary, you get a job. But if you're with me in the runoff, you get good government. And I think what old Earl was saying is, if you're with me before I ever ran, we share an agenda. But if you join me only after you know I'm going to win, you're going to usurp my agenda. Now, when you go to your congresswoman or congressman, build that relationship on the front end, then she or he will trust you that you share an agenda. And so when she or he needs advice, they'll call you up. Now, if the hand that rocks the cradle rules the world, the person giving advice to the person who needs advice on health care doesn't rule the world, doesn't even rule the congressman, but at least has an influence. And that's the way it works. Now you can say he should take my call anyway. Well, why would he take your call? You don't know him. As far as you know, you may be a mole for the other side. You know, you never trust the other party. So as far as I know, you're on the other side. Let me give you an example of how this works in my own practice. There's an anesthesiologist named David Broussard. He works here at Oxnard in New Orleans. And he's in New Orleans. I'm in Baton Rouge. When I ran for state senate, David Broussard, now we all know anesthesiologists do reasonably well in compensation. He took a day off from his practice, came up to Baton Rouge on election day, stood on the busiest street corner in my state senate district, holding up a sign saying, "Vote today for Bill Cassidy." Now, he could have hired 10 people to do it, but he came himself. David and I share an agenda. If he pops up on my iPhone, I say, "Excuse me, Mr. Obama, I have to take a call from David Broussard." Because when you run for the first time, you remember the people that stood by you. You really do. I can't tell you how intense the experience is. People are calling you a dirty scallywag for all these things that you thought were noble and that they've decided were wrong for short-term political advantage. And if there's one friend that stands by you, you remember that person. You really do. And so I'm going to take some questions if I have time, but I just want to finish up by saying this. Knowing that I'm speaking to folks who are already involved in the political world, but I would ask you to step up your involvement. We just passed a 2,700-page document that is yet to be interpreted. That every day there's another article about, wow, this is what's in the bill? What I read today is that if a federal employee takes a subsidy from the federal government to buy insurance, the federal government may be fined $50 million for providing that subsidy. You with me? Okay, if your low-paid janitor who's a federal employee takes a subsidy, then the federal government's going to sue the federal government and their risk will be $50 million because this guy took a $2,000 a year subsidy. Okay, that's how the law was written. Very poorly. It needs to be interpreted, and there'll be an incredible amount of cleanup that goes out. You need to be involved with the understanding of that cleanup. You need to be involved for your practice, for your patients, but frankly, because we're Americans. Because this is our country, and what we learned in 10th grade civics, as it turns out, is true. Those who are involved will shape public policy, and if you're not involved, you have no role thereof. And for our country to harness the genius of the people in this room, the knowledge that you take for granted and that people up there do not know anything about, you've got to impart that knowledge to them. It's a messy, slow, frustrating process, but it's worked pretty well for over 200 years. So I want to thank you for being involved politically. I want to thank you for supporting my campaign. I am incredibly appreciative. I would not be here were it not for folks like you, and I'm incredibly appreciative. And I just look forward to your involvement to even a greater degree. Our country will be better for it. Thank you very much.